Hello, my name is Michael Shacklock. I'm a musculoskeletal physiotherapist. I trained in New Zealand and now I live in Australia, and I currently do research and teaching from Australia, but in many countries around the world. My main areas of interest are research in neurodynamics, and currently we're doing a line of research with a group in Finland, Marinko Radan's group, in Finland in investigating spinal cord movement, and I'm also doing some study on ultrasound imaging of peripheral nerves. However, we're bringing that into the clinical situation and helping therapists move nerves and make diagnosis and treatment approaches for clinical neurodynamics, which is the area that I teach. I've written a book in that area called that name, and it's become internationally recognised, and we teach that all around the world in about 30 or 40 different countries. I'm very happy to be here in Portugal with Bwizer to do more teaching. We teach under the name of Neurodynamic Solutions, and mostly what we emphasise is clinical application of neurodynamics. So our courses are very practical and physically oriented. We emphasise manual therapy skills in diagnosis and treatment, and we include the clinical reasoning approaches, and it's a really clinico-scientific approach, understanding mechanisms of neurodynamics and applying them clinically. We run seminars, of course, in many areas, and I'd like to extend a personal invitation to you to come to our courses in Portugal, and please come along. They're fantastic courses, and welcome to our courses in the future. Just imagine you have a patient who has sciatica, pain in pins and needles down their limb, or cervicobrachyalgia with pain in pins and needles. These are really common problems, and they need obviously a specific diagnosis as to which mechanisms are causing the problem. Now, clinical neurodynamics is a manual therapy system of diagnosis and treatment. It's clinico-scientific, so it links the scientific research on the causal mechanisms, and it helps the therapist make a diagnosis through physical testing, interpretation, and finally planning a treatment approach from low to high progressions based on diagnostic categories. And a key aspect of it is manual therapy and finally neurodynamic testing and treatment. What people will get from these courses are manual therapy diagnostic and treatment system, so that they can solve and sort out specific relevant components for their patient problems. The courses are very practical, with about 70% practical and 30% theory. So we just have enough theory to support the practical, and we explain and show how to do the detailed neurodynamic testing with precision, so they can make an effective diagnosis and do manual therapy treatment of those problems.